Good afternoon. Assalamu alaikum. Thank you for joining this live session from our platform on COVID and diabetes. Just to introduce myself, my name is Dr. Abdul Jabbar. I'm consultant diabetologist and endocrinologist at Medcare Hospital, and I teach in many university places as well. We all know now by that coronavirus COVID-19 pandemic has changed the world all over in the recent past. Increased risk and what to do. So there are many questions in the mind of patients as well as people who take care of those patients. As a diabetologist, I'll touch upon few things which are important for you to learn, and then we will open it for question and answer session. So to begin with, most of my patients or their relatives will ask, being diabetes, am I increased risk of contracting coronavirus infection? The simple answer is no. Why is it so? Because you have to understand that being diabetes does not open the doors unless you open your doors. It is something like a thief is about to attack in an area if you keep all your doors closed. So what are the doors closed? I'm not keeping mine off now, but I'm sure you are all wearing your mask and keeping distances, etc. That is a way of keeping your doors closed. So when your doors are closed and the attackers are all around you, they cannot attack because your doors are closed. So remember, although you are a diabetes patient and people around are hearing you, telling you about the COVID infection, if you keep yourself safe in terms of all the precautions, which I'm going to talk later on, you are safe. Then why is it so much hype about people so frightened and afraid about diabetes and COVID? The reason is that, as we all know, any patient with diabetes, once they get an infection or an injury, it takes longer to heal. It takes longer to recover. A patient with diabetes, even if they get a cough, they get a pneumonia, they get a flu, they get a fever, or they get a cut, everything takes longer to recover. So that's why we say be careful, but obviously you hear so much about it, there are reasons. Because people with diabetes, if by any chance they contract the coronavirus infection, the chances of their getting worse, getting complications, going to the hospital, going to the ICU are increased. So the first message, as I told you, keep your doors closed. The second thing is, although despite all the best efforts, people at increased risk may get the infection. What should we do then? Then, as we all know, you have to keep your army strong. Keep your guards strong. So if a virus attacks you with 50,000 force, and if you've got 100,000 force in place, you will kick it out. So how do patients with diabetes keep their doors closed, keep their army reinforced? So number one, check your sugar. Your sugar, if it is in good control, and in the last 2 or 3 months, I've seen many of my patients who got the disease and without any problems, they recovered very well. So keep your sugar control very good. And how do you do that? You know already how to check sugar at your home. So check your fasting sugar, but remember, as most patients forget, you must check your post meal after eating blood sugar as well, and make sure it is in good control. At the same time, the second important thing is most patients with diabetes have got other issues as well, like they've got hypertension, they've got heart problem, they've got kidney problem. All these things are the multiplier, and that's where it's not only the diabetes. We have seen that the most of the problems and leading them to the ICU or complication is in patients who have got blood pressure, hypertension not adequately controlled, or they have got already a heart problem not adequately controlled. So you've been given medications for your blood pressure, for your cardiovascular disease by your heart doctor or your diabetes doctor or by your general physician. Don't stop those medicine now. Keep it watchful, and again for the same reason, monitor your blood pressure as well. So these are the important things for you to follow so that your army is strong. The other things which are mentioned, and there are so many things coming on the WhatsApp and social media now that you are confused what to believe, what not to believe. So we don't have strong evidence about the data, but what we do know that vitamin D is important, and we have learned from before as well that patients who have got low vitamin D, they get flu infection, respiratory infections quickly, and if their vitamin D levels are good, they don't do that. So make sure if you are taking enough sunlight, but that's not all the case, we already know. If your doctor has given you vitamin D, take vitamin D and calcium. Vitamin C is good, but you don't need a mega dose. Don't start taking it, especially if you are diabetes, because many of the vitamin C tablets, especially the ones who make the fizzy drink, have got glucose in there. So we may be taking vitamin C, but increasing your glucose level. So make sure you are not doing that. Zinc is another thing which is important, and it is commonly found in most of the natural foods we eat, like the whole grains, like nuts, seeds, meat, dairy, and eggs. So these are the few things which will make your army, your immune system strong, so that you are able to fight the disease when it comes. And don't delay. If you get a flu infection, if you got a feverish symptoms, if you got cough going on, do contact your doctor, so that if you are aware of it and your doctor is aware of it, we can start the medications early on when it is needed, and we can take care of the problems early on rather than delaying it for long. So now I will just briefly touch upon few things which you should remember before I open it for your questions and answer. So what are the best practices for people to avoid COVID-19 infection? Simple, we have been going through, and now fortunately in Dubai and UAE, we are fortunate that we are not in the lockdown. But not in the lockdown doesn't mean you don't have to take the social distancing again. So stay at home as much as possible, although you may be going to the work, etc., but nothing extra to home. Number two, wash your hands often. Anytime when you touch something else, something outside, it's easier to wash your hand. If you're washing 3 times, make it 10 times. It doesn't trouble you, but you get rid of the virus which is attached to your hands for your finger. Number 3, don't take your hands to your eyes, to your nose and to your mouth, because this is the channel where anywhere you touch some place or some object which has got virus, you'll let it enter your body. So you don't want to enter. As I said earlier, keep the gates closed. If the gates are closed, the virus will not be able to enter, and if it enters, it will be 5 or 10 pieces of viruses rather than 1,000 or 5,000. You can keep cleaning the surfaces in your home, in your office, etc., where somebody else is touching the things, so that you know that they have been sanitized, disinfected, and they are not holding the virus anymore. And again, as I mentioned, increase your glucose monitoring. If you are not doing it before, some of my patients come and say, I haven't checked my sugar for the last 1 month. That's not allowed. That's not fair. How would you know if your sugar is improving or not improving unless you check? Because your sugar doesn't tell you that it's high or low unless it's very low or very high. Most people don't understand their blood sugar will not tell them anything unless it's more than 250 or 300 milligrams per deciliter. So important to check it so that you know, and if it is not in control, what to do. The doctors have given you some guidance in terms of adjusting your dose, adjusting your insulin, and if it is not possible for you, now most of the centers including Medcare has got telemedicine services. You make an appointment even if you don't want to go to see the doctor easily, but if the doctor talks to you or consults on the telemedicine, they want to know what's your blood sugar level, what the medicine you are taking, and not only the fasting one, which is after an 8 hours fast, which is likely to be normal or low. It doesn't guarantee the 24-hour. So you have to check it after your good meal when you are enjoying all the good dishes at your home, because you are in the lockdown and eating a lot more than you should be doing. The other thing is improve your nutrition habits, your eating habits, keep yourself active, physically fit, some exercise, get enough sleep, and be aware of your anxiety and stress and all that. Finally, just to touch upon that, you know, all of you, that most of the guidelines mention, rather than COVID or no COVID, patients with diabetes are at increased risk, so they should be getting influenza vaccine, flu vaccine, pneumococcal vaccine, etc. So in your next visit to your doctor, if you haven't got it, you may ask for it, but for now we are avoiding all the new vaccinations because of this pandemic going on. So I will pause for a while, see if there are any questions, or otherwise I'll give you more tips later on. So open to questions. Thank you.
Thank you, doctor. We had one question popped up, is that, doctor, you have mentioned that the immune system will be affecting us of COVID-19, but the patients who's having the diabetes, their immune system is low already. Can you elaborate a little bit what's the difference that if they get, how they would get from, because they are diabetic, how would they get COVID and then how it will affect them? And if their immune system is high and strong, how it wouldn't affect them?
So, good question. As I just touched upon that, there are certain things which are in your control. And the most important thing in terms of your immunity or immune system control is your glucose control, your blood pressure control, your cholesterol control.
Correct.
If you are a good patient under good care, all these things should be already in good control. And that's what I said. I've seen many of my patients in the last 2 months who did contract COVID infection. They were diabetic. They even didn't go to the doctor or hospital. They recovered very well sitting at the home or in the isolation center which has been set up. So this is a good chance that your immunity is good. But if your glucose control is not good, your blood pressure is uncontrolled, don't wait. I will go and see my doctor after 2 months when the lockdown is finished or COVID is finished. That's too late. You have to go and contact your doctor early, or if you are unwilling to go because if you are one of the categories which has been recognized as high risk. So what are the high risk categories? Because their immune system is already not very strong. Number one is, as you mentioned, diabetes, and I will say diabetes with poor control, not all diabetes patients.
Poor control, yes.
Number two is the patients who are above 60 years of age. Number three, we've got diabetes plus blood pressure. So if the blood pressure is there, if you are controlling your blood pressure, you are improving your immunity. At the end of the day, what are you eating? If you are eating the foods which are not good for patient with diabetes, like high sugar, high refined sugar, high carbohydrate, greasy fried items, and some of the people in the lockdown, they ended up doing that. Because now the patients are coming back, we see many of them say, oh, I put on 3 kilograms of weight because I was not exercising, but I was eating. So those are few things. I gave some tips about it, eating the natural healthy foods like dairy products, eggs, meat, vegetables, fruits, and these are the items. Vitamin D, you can take tablets over the counter or otherwise as well, vitamin C, etc. So these are the important things to boost your immune system.
To boost your immune system, even if you're diabetic.
Diabetic.
Doctor, another thing popped to my mind is that we mentioned right now is that if you control your diabetes, blood pressure, all of them, you're gonna have a good immunity system or strong. The type of, you mentioned 60 years old and above, which is I think most probably type 3 of diabetes or 2, yes, which is they have insulin. They are on high risk because the immune system is weak. How can we try to give them advice about that, before especially this high-risk people?
So as I mentioned, when we say high-risk type 2 diabetes, there are multiple factors. Number one, as you said, anybody who is 60 plus compared to anybody who is 40 below, you don't need any science for that. This is more strong, this is less strong for anything to happen. The number two is because their diabetes is older. They are not only older, their diabetes is older. So if this patient has diabetes for 5 years, they've got diabetes for 20 years. So they need a better control. And as you mentioned, some of them are on insulin. And when people are on insulin, they are not taking the right dose to manage it properly. So these are the things. And finally, the important thing is most of these patients are having blood pressure, heart problem, kidney problem that makes them high risk as well. So what to do about it? Number one is follow the rule number one. Keep your gates closed. Don't go out. Avoid the social meetings, other gatherings, etc. if possible for you. That's the simplest and easiest way to avoid COVID entering your body. So that's number one. And once you find out in case it has entered, you do all the precautions, but then in that case, don't delay seeking medical advice from your doctor, from your internal medicine team, from your diabetologist, etc. so that they can give you some medicines to cover it as soon as possible, and you are in a good hands in terms of good care, because age is something you cannot change, and you cannot make a 60-year-old 50-year-old.
Of course.
That risk is still there.
Yeah.
So you have to just keep yourself and your army more strong so that you are able to fight the virus better way.
Okay. Doctor, you mentioned also something about the exercise. How would exercise really boost the immune?
So exercise is something which on the one hand takes care of your glucose control, your blood pressure control, your cholesterol control. That's one way of that. The other thing is exercise changes the oxidation potential in your blood and your cells, in the defense cells as well, which makes you stronger. So you feel strength in yourself, but your body immune system strengthens as well. That's to do with the cytokines and the other inflammatory markers. So as we have learned over the years, not a point of discussion for everybody, that one of the biggest challenges physicians are facing in patients who are admitted to the hospital with COVID infection is the cytokine storm or the inflammatory storm. So this is something which depends on the body inflammatory response. So if you are exercising, you are fit otherwise, and if your controls are good, the chances of getting cytokine storms are lower compared to those who are not doing it.
So who's not doing exercises?
Yeah.
So exercise,
Physical
who's
fitness.
having like a good or strong body, there are less chances to get it.
Correct.
Which is okay. That's doctor. About question, the pancreas usually who provides the insulin to the body, and if some people they have a chronic pancreatitis issue, which is sometimes the insulin is pumping in a different ways. Would these people be in a high risk?
So let me correct it for the knowledge of my patients and people at large. Chronic pancreatitis is a disease which is different from diabetes. Although patients with chronic pancreatitis may have diabetes also, but chronic pancreatitis is to deal with the enzymes which are released by the pancreas to digest your food. So if you're not digesting your food very well, obviously your iron is low, your B12 is low, your vitamin D is low, and those things can decrease your immunity and your body control as well. But it's not the way we talk about the type 2 or type 1 diabetes when there is a problem with endocrine pancreas. So exocrine pancreas makes enzymes to digest your food. Endocrine pancreas makes hormones to manage your metabolism. So one is inside your gut, one is outside
Outside your gut.
And so most problems which we have faced now, unless they have got diabetes with chronic pancreatitis, it's not at increased risk unless they are very thin, they are losing weight, they are poor control. So our focus is endocrine pancreas, which is giving rise to type 2 or type 1 diabetes.
Type 1 to diabetes. Doctor, another question, which is we have mentioned that the obesity patients is more high risk to get COVID-19. Of course, they are diabetic. So what is your input of all of that?
So as I mentioned, we talk about type 2 diabetes in particular at a high risk for the reason they've got other things which are part of type 2 diabetes. And across the world, but especially in this region, obesity is one thing which is very, very closely linked to diabetes.
True.
If you're obese, you may not know you are diabetic, but you will be pre-diabetic. You will be borderline diabetes. So these are the things which you don't know, but sometimes of the day your blood sugar goes up. Sometimes early morning when you are fasting, it should not be 115 or so, it's high. So these are things which are compromising your immunity. At the same time, people with obesity, unless they are taking care of themselves, they are less likely to move about, they are less likely to exercise, and their body functions overall are not running at the best metabolic potential. So their risk increases just for this reason, that their weight is there and they are not making efforts. The other important thing is nowadays we think fat itself is a big organ in the body which releases many of the hormones or cytokines. And these are the ones which are contributing to the inflammatory storm which is happening. So you've got a lot of fat in your body, increases your risk. And again, the simple message is in those situations when you're at high risk, try to keep your gates closed so that you don't let the virus enter. Because if virus enters, this is going to be a tough fight for your body, especially if you've got multiple things happening diabetes, obesity, blood pressure, heart disease, kidney disease, etc.
And it will hurt you. Doctor, some related question about the obesity, maybe not covered. Would thyroid be one of the reasons that you might be obese, not only because you are...
Good question. So just to give you a brief answer, because this is not a thyroid session,
Yeah.
many of the patients come to me or are sent to me that I'm putting on weight, I'm unable to lose weight, I would like to check my thyroid. So I will say, just a rough estimate, if I check thyroid for 1,000 of these people who come to me for that, maybe one will have thyroid as the reason for their obesity or overweight.
Obesity.
999, it's not that thyroid, it's either pre-diabetes
Okay.
or diabetes in the family or obesity in the family or poor lifestyle, bad habits of eating, not recognizing that one of the important or few of the important things which contribute to your weight gain are the very often eating things we do.
Habits, yeah.
Right? So when I tell them it's your bread and rice which is making you fat, they say, oh, I've stopped all the oil. Oh, oil is not doing it. If you are a pre-diabetic or it's in your family, it's the bread and rice and even fruits which are contributing to that rather than oil and fried food. I'm not saying start
Yeah.
eating fried
Yeah.
food, but I'm saying there's a lack of message coming there from the doctors as well as from the knowledge from the social media. So that's why, as I say, many of the patients will come to me and say, oh, doctor, check my thyroid because I'm gaining weight, I'm not losing weight.
But doctor, in here, maybe in the country, or it's a little bit hard to control it because of the fast food, and all of us, like during work, we need just a small meal, fast. But any comments on that?
So very good question. And the answer, if I simplify it very much, nobody likes to wear the mask. Who likes it?
Stop the fast
Stop
food.
it, right?
Yeah.
But now when I say, oh, if you stop it, you are in foods later with diabetes, heart problem, kidney problem, weight problem. But because that's taking long time, 5 to 10 years, people don't listen to me.
Yeah.
But for you, everybody listens, and like you, everybody is wearing the mask.
That's true, because that's the normal human being.
Yeah.
Doctor, one of the last questions for you is that kids with probably most of the kids, they will be type 2 diabetes, I think.
Type
right?
1.
Type 1, yeah. And are they on a risk of COVID?
Yes, so all diabetes patients are at increased risk for the same reasons. And again, the same rule applies. Type 1 kids, if they are poorly controlled or not good control, the one important difference between the two is that kids are kids, number one. Number two, majority of them are on type 1. Number 3, if they are type 1, all of them are on insulin. And with the lockdown, sitting at home, foods being available, checking not very frequently, not adjusting their insulin. And that's an important message there. These kids, and especially anybody with poor diabetes control, they need to see their doctor. And now our guidelines say, keep the kids under 12, people above 60 at home. But look, this message is for people who are good, fit and healthy.
Correct.
But if you need that your poor glycemic control, your young one needs to see the doctor, arrange a telemedicine or try to visit some place where there is no much COVID or virus infection, but get them sorted out for diabetes control early on. For kids who are not at high immune risk in terms of type 1 diabetes or other infection, somehow we have seen that either they are not getting the infection or if they are getting infection, their recovery is not bad.
Not bad.
The
Yeah.
reason could be kids are in an age where everybody is more likely to develop their immune bodies and immune systems very well. Like we get measles, we get chicken pox, we get so much of the infection. And they are able to strongly fight it because their body is not at problems with the diabetes and obesity
Correct.
and blood pressure, etc. But it's still good to take care of those under 12 so that their immune system is good, they're eating healthy food. And if they are type 1, that's definitely, they should be either teleconsultation by checking their blood sugar, by checking their A1C, the glycated hemoglobin. Make sure that their control is good. Otherwise, consult with your doctor.
Thank you, doctor. Actually, we are finishing the session, but I just wanted to ask you that since we are in general not about only diabetes, that right now they opened back the malls for kids and everyone. Is there any general advice you would like to give it to them as well, to make sure that all of them secured and safe?
The advice, I think, is equally applicable now for maybe many months to come, because we are not still clear of it. We are in much better shape. So the usual precautions which are advised, to wear the mask, to sanitize, to use the hand washing frequently, don't touch the items which you don't have to, and go back home, again wash yourself, wash your hands, sanitize yourself, and try to stay home as long as it is not necessary to go out, and especially to mingle with the people and to gather around some places, because we are still waiting for the clearance to be 100%, and we are not quite near there as well. Although fortunately, compared to other parts of the world, we are in a much better situation and we are improving day by day. So good wishes and best of luck to all my fellows who have joined me, and thank you very much to all of them.
Thank you. I think now I'm not gonna go to the movies. You give me advice to stay at
I
home.
think so, you shouldn't. So cinema has got high rate of infection because it's a closed space.
Oh, okay, that's done. Thanks, doctor.
Okay, good. So should we close?
Close.
Okay, so again reminding you, my name is Dr. Abdul Jabbar, consultant diabetologist and endocrinologist. Feel free to connect and make an appointment if you want to discuss further about any of your issues related to diabetes and endocrine, whether COVID or not COVID. Thank you very much.
Thank you. Stay safe.